Hello, this is Dr. Lisa Shiver with a presentation on roles and delegation. We're going to start with the role of the registered nurse. Once a nursing student finishes the RN program, they are eligible to take what we call the NCLEX exam, and that stands for National Council of Licensure exam. They will choose a state in which they would like to take that exam. You could take it in Alabama, Georgia, Tennessee, wherever you wanted to take it. Once you pass that exam, then you will be licensed in that state or in that individual state. Now later, if you would like to apply for other licensures or be dually licensed, well then you would just have to apply to the Board of Nursing to get that license. Most states don't require that you retake the NCLEX exam. What you need to understand is the scope of practice varies from state to state, and what that means is as an RN in Alabama, I have to follow the Alabama scope of practice. As an RN working in the state of Georgia, I have to follow the Georgia Board of Nursing scope of practice. So each Board of Nursing for each state will decide what the scope of practice should be for which nurse, and basically that means what you're allowed to do as an RN. So just because I'm licensed in Alabama doesn't mean I can do in Alabama what I can do in Georgia. You always have to follow the state's scope of practice in which you work. In general, the RN is a decision maker, a delegator. They perform complex procedures, complex being a key word here, administer medications, initiates teaching, that means we do the first teaching, coordinates care, performs the initial assessment and interview, initial being the key word, and also the initial physical assessment. So with the RN, we see a lot of complex, initiation, initial, things like that. And that's different from the roles of the LPN, which we'll talk about in just a minute. How about now? Licensed practical nurses are also licensed per individual state. Once an LPN student successfully completes the LPN program, they can apply to take the NCLEX exam for the LPN. And then once they're licensed, they are licensed per individual state. So again, I can't take the LPN exam in Alabama and then go practice anywhere I want to. I would just have to stay in Alabama. So you're licensed per individual state. Again, the scope of practice varies from state to state as well, and I'm going to share with you some examples of that in just a minute. But in general, the licensed practical nurse is also a decision maker, can also perform procedures, but generally not those complex procedures. They can administer medication, they reinforce teaching, but what they don't do is initiate teaching. They follow plan of care, and they also can do assessments. But those key words, complex, initiate, initial, you don't see with the LPNs. LPNs work under the supervision of an RN. And just to show you some of the limitations, I pulled up some things that LPNs can and can't do within the state of Alabama based on their scope of practice. I know LPNs in Georgia have a lot more leeway and are able to do a lot more different things because their scope of practice is very different. But in Alabama, the LPN cannot administer IV push medications. They cannot administer IV fluids to a VAD, which is a vascular access device, and that would be like a central line, PICC line, or triple lumens they may be called, portacath. Those are all VADs. They cannot administer blood or blood products in Alabama, but I know in Georgia they are allowed to. That is within their scope of practice. They cannot add a medication to a bag of IV fluid. With additional training after they graduate, they may be allowed to insert an NG tube, insert a peripheral IV, maintain peripheral IV fluids, or administer premixed piggyback medications to a peripheral vein. So these are some pretty important things to know, considering, if we are an RN working in Alabama and we're going to be delegating to our LPNs, what can or can they not do. We also use multi-care technicians, often abbreviated MCT, or we call them techs. Please keep in mind these folks are non-licensed. They have not taken a licensing exam. They perform a variety of skills or tasks according to the agency in which they're working. Techs are used in many, many different roles. And again, they are going to vary from hospital to hospital how we utilize our techs. The key word with them is they do tasks. They are not allowed to assess, analyze, interpret, evaluate. They only can do specific tasks. And not to offend anybody, because that is not the purpose of this, multi-care technicians or our techs are not trained to analyze or to evaluate what they're doing. Examples of what a tech may do for you, like obtain AccuChecks if they've been trained to do that, obtain vital signs, assist with ADLs, things of that nature. What we need to make sure happens is that our tech has been trained in how to obtain AccuChecks correctly. If we delegate to the tech to go obtain an AccuCheck, we, the nurse, are responsible for that AccuCheck result. The tech is not. So if the AccuCheck result is 30, the nurse is ultimately responsible. The techs work under supervision of an RN or an LPN, and they also help follow the plan of care. You may also encounter nursing assistants or certified nursing assistants. These are also non-licensed personnel. CNAs have been certified by the individual state Department of Public Health, so they have taken a class and have obtained a certificate. And a lot of the long-term care institutions may require certification for their nursing assistants. So you might see some that are certified and some that are not. They do perform routine tasks, routine vital signs, follow the plan of care as well. But again, they do tasks. They do not do analysis of that AccuCheck reading, or they don't interpret the vital signs that they obtain. They only do tasks. They work under the supervision of an RN and or LPN. Got a Shiver hint for you. Although you may have multiple roles, you can only practice under the role you're currently working. And this is important to know because I know all of y'all are paramedics. As a nurse, if you are working as an RN, you can only practice in that RN scope of practice. I've got some examples here for you. An RN on duty in the emergency department who is also a paramedic cannot intubate. If you are on duty as that RN, working as an RN, that is not in your scope of practice to intubate, even though you are a licensed paramedic. A multi-care technician on duty who's in the last semester of nursing school cannot start an IV. They may know how. They may have started 10 IVs. But the tech can only work in their scope of practice. An RN on duty who's also a nurse practitioner cannot write prescriptions. So if there's a nurse practitioner who is working as an RN on duty, even though they have the ability to write prescriptions, in this circumstance they would not, because they are working as an RN. So the bottom line is you must always stay in your scope of practice for the role in which you are working. Let's talk a little bit about delegation. As the RN, you will delegate to others, but you must follow the delegation rights, and these are very important. Make sure you choose the right task, meaning what are you asking to have done, the right circumstances, the right person, right direction or guidance, and you provide the right supervision. If any of this falls through the cracks, the RN will be responsible. So make sure you choose the right task for the right person and give them the appropriate direction and also supervision. There's something else I like to include to these rates. Make sure you give them feedback for a job well done. Our LPNs, our MCTs, our nursing assistants, all of them work very hard to provide patient care and sometimes are underappreciated. So as the RN, make sure you're giving good feedback, especially for a job well done, to these folks. Because if you treat the folks you work with very well, they're going to take good care of you. Got another Shiver hint for you. Any activity that requires nursing judgment may not be delegated to an unlicensed personnel. And I mentioned that earlier. Unlicensed personnel just perform tasks. They don't evaluate, or they're unable to judge or analyze the results or interpret the results of what they have done. Also, unlicensed personnel do not perform invasive or sterile procedures. So a tech or a nursing assistant cannot start an IV. They also wouldn't do or administer a suppository or put in a Foley catheter or things of that nature. Little truth about delegating. Nurses are not liable for negligence of other workers, provided that the nurse delegated appropriately. So if you chose the right task, the right circumstance, the right person, you provided the right direction and the right supervision, and that person still did not do the task correctly, they will be liable for what they did incorrectly. But if you did not delegate appropriately, if you did not have the right task, right circumstances, or any of those 5 rights, then you as the nurse would be responsible. And we're going to practice some of this in class when we get to the classroom setting. So I'll give you some scenarios and you'll get to tell me, is this appropriate or is it not? When you delegate, you control the delegation. Who will do the task? What's an acceptable performance? But we also have to keep in mind that we're not expecting perfection for everything. The nurse transfers responsibility and authority for the completion of delegated tasks, but the nurse retains accountability for the delegation process. And that goes back to asking someone to get an AccuCheck. You ask them to go get it, they did it. But they're not responsible for getting excited if that AccuCheck is abnormal, or necessarily reporting to you if that blood pressure was abnormal, or telling you if the patient has a temperature. Now, a lot of techs will, but it is our responsibility as the RN to follow up and check those results. So the delegator retains the accountability for the delegated task. I know this is a little complicated, but we will go over more of this when we get to the classroom setting. I'll see you then.